the street, yeah, we bring the heat. It's your time to speak, or yeah, take your seat. Become eligible, become eligible. Hey.
Welcome back to Become Eligible podcast, where we talk about the highs, the lows, and everything in between in your journey to becoming eligible mentally, emotionally, professionally, and spiritually. There's a saying that goes, a man begins cutting his wisdom teeth the first time he bites off more than he can chew. But what if I told you that true wisdom starts with how you take care of your oral health early, consistently, and intentionally? If you've ever had dental care, if you ever thought dental care was just about brushing your teeth, this conversation will challenge that mindset and equip you with the tools to become eligible for a healthier, brighter future, starting with your smile. But before we continue, be sure to follow me on each and every social media platform that is at Become Eligible Podcast. That is on Instagram and TikTok, and my personal social media handle is at Kimani Sauce. If you have any question or feedback, or you just want to say hi, reach out to me using my WhatsApp number, which is 0700573437. And just in case you want to recap this or any other of my awesome episodes, you can listen to them on Spotify or any other place where you get your podcast from. While you're at that, kindly make sure you subscribe to this YouTube channel, because I promise you I have plenty of eligible awesome interviews for you. And today I'm joined by none other than Dr. or Professor Arthur Kemoli. Professor, good morning.
Yes, good morning.
How are you?
I am fine.
On a scale of 1 to 10, how fine are you?
About 9.
About 9. That's really good. That's really good. Before we continue, kindly introduce yourself.
Yeah, my name is Professor Arthur Kemoli. I'm a pediatric dentist. I've been practicing for a while. What else do I say?
For how long have you been? Actually, as I was researching for this interview, this podcast rather, I Googled you, and there's a CV I found of yours, and I was really shocked. You've done a lot of things.
I don't know, but anyway, for the last almost 20 years, I've been a teacher. Apart from practicing pediatric dentistry and general dentistry before, I've been a teacher at the University of Nairobi. And of course, during the course of my teaching, I have been able to mentor many students to become doctors, that is dentists, as well as specializing in pediatric dentistry. During that time also, I have been able to do a lot of research in the area of pediatric dentistry, particularly as concerning, decayed teeth and also relationship to the general health of the child. Like children who are suffering or living with HIV, children who are having various conditions that may be affecting their oral health as well. And then I have also been able to give talks, presentations to various conferences, workshops, not only in Kenya, but in various countries.
That's good.
So that during that time, we are sharing knowledge with other doctors from those areas and comparing the progress we are making in the care of the oral health of children. So briefly, that's what I've been doing.
That's really good. To start us off, why is oral hygiene? Is oral hygiene more than just brushing your teeth, or does it entail more other things?
Yeah, first of all, let me talk about oral health.
Yes.
Oral health means having your mouth in good condition and everything associated with the mouth.
Yes.
And when we talk about the mouth, it's just not the mouth itself. The mouth has got teeth inside, it has got tongue there, it has got other soft tissues around the cheeks, and then the bones that hold all these structures.
Okay.
So that is what constitutes the oral health of that particular individual.
Okay.
And when we talk about oral hygiene, we are talking about, in ordinary languages, how you keep your oral or your mouth clean.
Okay.
So that it is in good condition, infection doesn't come in because of carelessness on your part. So that's the difference. What else do you need to know?
My question was why oral hygiene is more than just brushing it in.
Right. It is more than brushing.
Yes.
Apparently, many people do not know that it is important to have a good oral health and also a good oral hygiene. What most people think, and unfortunately that's what has become apparent, the mouth seems to be away from the rest of the
Yes, most people do
body.
that. Yes.
And I would like to remind the listeners to this is that just like you have a leg, you have got a hand, you have got ears, you have got eyes, forming part of the body. The mouth also is part of the structure that forms part of the body. If your mouth is sick or it is diseased, the body will suffer. And the oral hygiene is important because if you don't keep your mouth in good condition, that means you are likely to get infection. And there are various infections you will get and diseases or conditions or you will get. And these conditions will affect the rest of the body. You know the mouth is used for talking, for eating. Now, just for example, if your mouth was to be shut, can you be able to communicate? Can you be able to eat? And if you don't eat, your nutritional status will also deteriorate, meaning your body will not function.
Yes.
Including your brain, your heart, and everything.
Yes.
So the mouth can also lead to you dying because you are unable to do what it's supposed to. It's unable to do what it's supposed to.
Okay.
Yeah.
You've mentioned type of oral infections. What are some of the oral infections?
The most common oral infections or conditions you will encounter is one. Very common is poor oral hygiene, because it's the condition where you are unable to maintain good oral hygiene. So your gums will then get infections. So we call it gingivitis.
Okay.
That is common. Gingivitis is where you have inflammation of the gum as a result of poor oral hygiene.
Okay.
And also infection can also lead to that.
Okay.
Then the next common one also is dental decay.
Okay.
We call it dental caries, but in the common language we call it decay.
Okay.
Where people say my tooth is rotten.
Yes.
It means the tooth has acquired cavitation as a result of a process where the tooth has been demineralized and then broken down.
Okay.
That is very common. The next also other common condition is periodontitis. Now, that is an extension from the gingivitis where the attachment, because we have got the tooth is attached to the bone by certain fibers, we call them collagen fibers. If those fibers become infected, then the tooth will not have a good attachment, so it will tend to loosen.
Okay.
And that is one of the conditions we call periodontitis. And then besides all those, there are other conditions that will come. Particularly, some of them are linked to the general condition of the rest of the body, or infection or chronic conditions that you may be having.
Okay.
So those are common things that you will get.
Okay, I didn't know we had a lot of oral infections. What are some of the common dental problems that most people ignore? Some of the oral problems that that people often ignore.
Well, the ones they often ignore is, of course, brushing.
Brushing,
the oral hygiene. The next one is the same decay, because decay is a process and it will start slowly. So you will get signs.
Okay.
You begin to get signs like sensitivity coming from the teeth.
Okay.
And that sensitivity may be an indication that there is something happening to the tooth, and that could be decay, or it could be also periodontitis as well. That's the gum infection. So when there is that sensitivity and you ignore it, it will also escalate into something else. If it is relating to decay, the decay will become bigger.
Okay.
And the tooth will begin to get cavitation, and eventually you will get pain.
Okay.
Pain, which we usually call pulpitis in our scientific language.
Yes.
Where the inner part of the tooth, which has the blood vessels and the nerves, has been affected by the infection, spread of the infection, and then you begin to get severe pain.
Okay.
And then also, if it is relating to the gum condition, then you will have the tooth becoming loose, and eventually it may fall out by itself. And then other things the people tend to ignore is broken teeth. We call it traumatic injuries, where you may have hit yourself, or something hit you, or something happened, and a part of your tooth broke. And some people may ignore it, thinking, anyway, it's just a small broken part, and you don't do anything.
Yes.
And that could also lead to other conditions. Maybe the tooth was hurt even internally. You may end up again with pulpo or the infection on the sensitive part, the inner sensitive part, which may die, and then you end up with the infection that will create an abscess or a swelling, which you'll see coming out. And then the other thing is, apart from that, it may also affect your looks, for example.
Yes.
And then the looks also will affect you in terms of self-esteem.
Yes. So.
And then if you are a child, you may find it very difficult to laugh or smile.
Talk in front of people.
Or it may hurt your tongue as well because of the roughness and so on. So those are common things that you tend to be ignored.
Okay.
Also, to be ignored are swellings. There could be swellings relating to the tooth. And the people may tend to ignore. Sometimes they think it's just a small swelling. Maybe something small has happened. But that swelling is an indication that there is something happening within the tooth or around the tooth, and they may grow into a serious problem. Sometimes it could eat the bone that is holding the teeth, and you end up with a bone which will fracture or break.
Okay.
And then end up with a bigger surgery that you may have avoided if you attended to that problem earlier. So those are basically the common things you experience.
I'm shocked that a broken tooth can actually cause more harm than the way we think. I thought it was just a broken tooth and that's it.
Besides, not even just a broken tooth, even decay can cause more harm to your body.
Okay.
Because that decay is as a result of bacteria infection. Now, that bacteria, once you form a cavity, other bacteria will also come. Bacteria will come in there.
Yes.
Some of them will be harmful to the body. And in some cases, they will find their way into the bloodstream. And once they find their way to the bloodstream, they could affect, in children or they will affect the heart.
The heart.
And you can end up with a heart problem arising, which actually arose from the mouth.
Wow.
The other thing, you can end up with that heart problem, with other condition, you can even end up with a kidney problem.
Just from tooth decay?
Yes, from tooth decay.
Oh my God.
You can also have the bacteria invading the whole blood system in massive way, and you end up with what we call septicemia.
Wow.
And the septicemia can lead to fatalities.
Wow.
If it is not attended to, and because it becomes an emergency.
Okay.
So that's why I was at the beginning, I said, the mouth belongs to the body. And do not ignore it, because whatever is happening in the mouth can affect the rest of the body and can affect your life.
Wow, that's very, I didn't know that. In regards to tooth decay, as I was researching for this, I found out that only 13% of health facilities in Kenya provide oral healthcare services, with significant gaps in rural and primary health settings. And only 58% of Kenyan population live within 20 kilometers of a dental clinic. And Kenya has a dentist that one was way later. So what are the early signs of tooth decay for someone who maybe they don't have access to dental care? What are some of the early signs?
Yeah, okay. One of the things you may notice when decay is starting, as I said initially, it will be sensitivity.
Okay.
That's just it. You may also, before that, you may see some discoloration.
Okay.
You always look at your teeth. You may see some discoloration appearing on your teeth.
Okay.
And then that could be a sign. Either discoloration can also be just because of bacteria activity externally that are producing colored substances that discolor the tooth.
Okay.
But it can also be as a result of decay beginning.
Okay.
That's one. The other thing that you may notice is, for example, food may be sticking between the teeth. Initially, you have not been having that problem, and then it begins to happen. Something is going wrong, going on wrong.
Okay.
So it is time to have yourself take yourself to a dentist and have that checked to avoid serious consequences of that. So those are the things that you will initially see. Apart from the color, apart from the sensitivity, and then the
food, the gaps,
the food packing.
Yes.
Other people may begin to feel some pain, and that means it may be advanced.
Okay.
A pain which comes occasionally and goes away. It comes occasionally and goes away. But that will be meaning, of course, one, it's advanced, but it's a warning something is happening to that tooth if you ignored all the other signs.
Okay.
Yes.
You've talked about sensitivity, food packing, and I think that one can be solved by people brushing their teeth. What are some of the brushing techniques for babies, toddlers, and older kids?
There are various techniques for brushing.
Yes.
Majority of the people will use scrub, what we call the scrub technique.
The scrub technique?
Yeah.
Which
especially
technique is that?
in the children, because children cannot maneuver because of the dexterity of their hands. The muscles are just developing. They are not able to do many of the maneuvers that an adult can be able to do if they are young children. So what we do, we tell them to brush just from front to go backward on the front to backward on the outer and the inner part of the tooth, and then also on the top, the surface of the teeth, so that they are able to remove the food particles that may be on the tooth surface. The other one, this will be for people who are able to maneuver well the adult part of it. You will go in circular form, so that you are able to remove particles easily when your brush is in a good condition. You remove particles that may be sticking in between the teeth, and be able also to remove those on the surface of the tooth, and then you scrub on the biting surface of the tooth. Then, in addition, you use what we call floss, dental floss. And dental floss is a thread, a tough thread, that you put between the teeth, and you rub from the tongue side to the cheek side, or from the tongue side to the lip side, along the surface of the teeth where they meet each other, and they remove particles from there.
Okay.
So those are the ways you do. There are other means. There are various. People have developed various ways of brushing.
Yes.
But basically, that is the simpler way of doing it.
Okay.
Yeah.
Since you are a pediatric dentist, are mouthwash safe for kids?
It depends on the age. You are going to rinse the mouth.
Okay.
Now, if a young kid, you don't expect a 3-year, 4-year to rinse the mouth without having to swallow that.
Mm-hmm.
So if it is just for mouth rinse, you want the child to rinse the mouth with it, you are waiting for a child to be of age.
Yes.
If it is necessary because of some infection that needs a mouth rinse, then at the age of 6, a child will be able to rinse and spit.
Okay.
A child younger than that, if you really want to rinse, then you would rather do it yourself using like cotton, and then clean the area you want to clean.
Okay.
So you don't leave much of them. And the other thing is the mouth rinse should not be used perpetually, because it has got some of them have got some antibiotic. That's the things that kill bacteria. And if you use it perpetually, the bacteria will become resistant.
Okay.
And therefore it will be ineffective.
Yes.
So we usually advise, use it for a maximum of 2 weeks, have a break, and then you can reuse it later.
Okay. That's good. There's some oral myths that I hear people talk about, and I want you to demystify or confirm if they are true. That whitening ruins teeth.
It depends. We do in one of our treatment is to whiten teeth. Depends. Because some people have got teeth that are so discolored.
Okay.
That is affecting their self-esteem.
Yes.
And therefore you need to do something depending on the cause of what has made them be discolored. Then you will consider various things of whitening them. There are products that are sold to us as dentists that are used for whitening. However, for the public, I have seen some of them just think teeth should be very white.
Yes.
So they say, I want whitening, even where it is not necessary. We have to remember each person has got his or her own color of teeth.
Okay.
It's not uniform.
Yes.
Even the tooth in the mouth, the color is not uniform from the root to the biting surface.
They're not the same. I thought
so it's not the same.
Okay.
So when you talk about whitening, be careful. We only consider whitening where it is really affecting. We can see the effect of that whitening, of that discoloration it's something that needs to be prevented. Then we recommend that. But it is not that anybody who comes because the teeth look like this, I want whitening. And remember also, as you age,
yes,
the color of your teeth also change.
Okay.
They become darker. If they have been traumatized by the heat, they may also change color. And that may necessitate whitening because you need to make them look like the rest of the teeth.
Okay.
So those are the various things you consider.
Okay, I'll come back to this, to whitening, and we're going to talk about fluorosis a little bit. Another myth that I heard, actually a friend of mine told me this yesterday, that someone told her that if your tongue is white, that means you're not cleaning your tongue properly. Is that true?
Yeah, yes. The tongue, on the surface of the tongue,
yes,
particularly the top part of it,
yes,
you will tend to have what we call plaque accumulating. Yeah, the white substance accumulating on the surface of that tongue. And we usually recommend when you are brushing at the end also, brush also that on the top of the tongue to remove the plaque.
Okay.
So if you don't do that, yes, it will remain with a white layer of plaque on it. And that white layer of that, the white layer consists of bacteria and food substances, and that can also make your mouth smell.
So if your tongue is white, that means your tongue is not healthy.
Not really. It is just that you have neglected doing what you need to do.
Okay.
But it may be healthy. Underneath there may be healthy because some of it has not been there for long.
Okay.
It may be something that has just been there for hours.
Okay.
So you can't say the tongue is
unhealthy. Okay.
It's just a neglected part of the part of the patient or the person having not cleaned the tongue, just like you clean the surface of the tooth.
Okay. Okay. There are these tongue cleaners. Do you recommend that?
Yes, they do help, depending, of course, on the age. They do help because they make it easier for you to clean rather than using the brush to do so.
Okay.
And some of the toothbrushes do have tongue cleaners at the end, the other end of the handle. So you can also use that.
Okay. Okay. Now, the one who asked me that question, I know you've gotten your answer. Now, let's get into fluorosis. What is dental fluorosis and how does it develop?
Dental fluorosis, to relate it,
yes,
when a tooth is forming, there are certain chemicals that come into play in the body.
Okay.
You have calcium, you have phosphate, and so on. And they come together to form crystals.
Okay.
Crystals that aggregate together to form the teeth.
Okay.
Now, during that formation, there are cells in the body which specifically form the tooth.
Okay.
During that formation, these chemicals are concentrated there, and then the cells use them to form the tooth. If you are ingesting a lot of water which has got fluoride or foods that have got a lot of fluoride, it will also go there because it's an active site. And the active site attracts various things, substances to come there because the cells are energetic, they want energy, they also want chemicals. So as the blood distributes the various things in the body, they will go there and end up there. And then after that, the cells will utilize them.
Okay. Now,
in particular, when tooth forming is taking place, a lot of fluoride or fluoride as a chemical will then be taken up and incorporated into the tooth structure.
Okay.
The advantage of this substance, fluoride, is that it is a smaller molecule than another molecule that is usually displaced when it comes into play. That molecule is bigger and the other one is smaller. So this smaller one, when it is incorporated, it becomes compact.
Okay.
And then, of course, it strengthens the tooth because if there are molecules compact, it strengthens the tooth. The only problem is there are defects that come with it. So you have some porosities forming because of it when it is in high quantity. When it is in normal quantity, very good. It strengthens the tooth.
So at some point, fluorosis is kind of good.
It is good. We recommend actually using fluoridated toothpaste. We recommend that. We recommend that children take some water with a certain amount of fluoride in it because it strengthens the tooth. See, the crystals will be compact.
Okay.
So the tooth will be stronger. However, when it's in excess, that's when the problem arises. And then you end up with porosity formation in the surface of the tooth. And then when the tooth comes out of the gum, you will see it as very white.
Okay.
Looking whitish, milky whitish.
Okay.
Now, as it goes into function, it starts accumulating, things start accumulating into those porous areas. And then you start having discoloration, browning, and so on. And that is. Now, because of the excess intake of that fluoride, the tooth becomes brittle as well because of this various structure with porosity forming.
Yes.
It becomes brittle and easily break.
After prolonged, after the fluoride has formed on the...
When it is in excess. When it is normal, the tooth is strong.
Very strong. But when it is in excess...
But when it is in excess, now the
big.
disadvantage is the tiny porous areas you get.
Yes.
And that weakens the tooth again. So you'll find the teeth which are having lots of fluorosis. That's the fluorosis, the one we talk about, fluorosis or fluoridated teeth with fluorosis, dental fluorosis. These teeth are usually brittle.
Okay.
And they will easily break when subjected to high amount of force when they are biting. So they break. Apart from that discoloration that you see. And the discoloration now does not render the owner of the teeth to have a good aesthetic, that is appearance.
Self-esteem also.
And then when breakage comes in, it distorts the tooth shape. And then it creates areas where food will now stick. And that's giving room for also dental decay to happen. So you may get a fellow who is having dental fluorosis with lots of decay.
Okay.
Whereas fluoride is supposed to protect the tooth from decay because of the stronger surface that it creates on the tooth.
Okay.
And in effect, what we do, we tell fellows to use, whether you have dental fluorosis or not, use fluoridated toothpaste. Why? Because it helps to form a stronger layer on the surface, a stronger layer of a tooth layer, which covers the surface, or the outer surface of the tooth.
Okay.
And therefore, difficult to decay. And also protecting the tooth from that decay. So that is how it goes, the dental fluorosis.
Okay, you say that it can also be caused by foods that have high fluoride.
Yes.
What are some of the foods that have high fluoride?
There are some foods and the plants that accumulate a lot of fluoride from the soil. Some of them, one is tea.
Tea?
Tea has got fluoride in it. And another one is that mrenda thing.
Yes.
Yes, it does accumulate a lot of fluoride. So if you are from an area where there is a lot of fluoride in the soil, and there is tea from there, it will tend to have a high amount of fluoride in itself. Or if you are growing vegetables that accumulate that, then they will have high amount. And therefore, if you are eating on a daily basis, then you are likely to get fluorosis.
So even if you're consuming tea on a daily basis, there are high chances.
Well, it depends on the amount that is there. If it is within the normal, the normal means 1 gram in a liter, 1 part per million. So 1 gram of fluoride in a liter of water is okay. That's the optimum. But if you are going to have like 28, whatever, like what you get in the lake of Nakuru, then it is exceedingly high.
Okay.
And apart from causing teeth problem, it will cause other problems to the body, bones, and so on.
Okay. I was shocked because I love my tea. I thought maybe fluorosis was going to catch up with me.
It may be good to you if it is in the right amount. It's good for the teeth.
Okay.
But if it is very high, that's when it is. I suppose I don't know if the quality of the amount of fluoride is measured before the packaging. That I couldn't tell.
That's something I didn't know that.
But I know KTDA was promoting taking of tea because of fluoride at one time.
Okay.
They were doing the promotion.
Yeah. How can parents identify early signs of fluorosis in their children, and what steps should they take if they suspect it?
One thing I have to say, first of all, you start from where you are living. Some of them do know areas where we have a high amount of fluoride in the water systems there. So if you are coming from an area where there is a high amount of fluoride, you should be suspicious. Maybe my child could end up with fluorosis. And we are talking like areas in Ngong here.
Yes.
Even in Nairobi here, a lot of areas have got a very high amount of fluoride.
Nairobi? I didn't know Nairobi. I thought it was only Ngong and Rongai areas.
No, even Nairobi here, Langata, wherever, the people, even in some of these, even in some estates here, there is a lot of fluoride in the water, the underground water. And I suspect in a few years to come, we might have this condition actually becoming a bigger problem, because many of the new developments have got boreholes now.
Yes.
And they do take measure. I mean, they do usually report on the amount of fluoride that is in there when they have dug their boreholes. But what steps are we taking to protect the children? I do not know. However, the signs will be starting from where you are living. The next thing will be when the teeth begin to come out. The unfortunate thing is that the primary teeth are less affected than the permanent teeth. So you may not notice immediately when the milk teeth come out. But when the permanent teeth come out, that's when you notice. And you may see your child having very white teeth.
Very
white. Those are signs. Sometimes they have some striations that are white.
I've seen that.
Those are signs that there is.
Those are early signs of.
Yeah, before the discoloration begins.
Okay.
So those are things.
Okay.
Yeah.
Once someone has already known that they have dental fluorosis, what dental cosmetic treatments options are available to improve their teeth?
Yeah, that's why you have to go to the dentist, and then it will be assessed, and they can make a decision on what to do to improve the looks of that child. One of the things, if it is not severe, we may just leave it, because it may not be causing any serious changes in the appearance of the child. But when it is maybe moderate, you may then consider whitening. As I told you, there are chemicals that you use for whitening, where you immerse the teeth there, and then they will, depending on you use a special light, and you will do that. And then again, what you have to remember, it may recur again. It will recur. It's not something that you are doing permanently. There are other things we use. For example, after we have done the whitening, we will block those small tubules that are on the surface with another material, and that could make it longer. Now it lasts longer, so that you don't have repetition. The other thing you may do is to get a new facing on the surface of the enamel. You remove the one which is discolored, and you replace it with an artificial surface, a material that you put there, and then it will be okay. And the other way is to crown the teeth. You put a crown on the teeth, and then it will be another means of doing it. That is when it is very severe, especially when they are breaking and they are severely discolored, so you will do that. That's a long-term thing.
So as long as it's not affecting you, my people from Rongai and Nakuru, keep it. That's good for you. How does nutrition affect our oral health?
Well, nutrition is, of course, when we talk of nutrition, that means the nutrients you are getting for the general growth and development of the body. And if you look at children, when they are growing, teeth are forming, they need nutrition. There are chemicals that are required for formation of teeth and the attachment of the teeth. And basically, if you are not taking the usual ones, which will include, of course, proteins, the vitamins, and what have you. Those are necessary for the child's growth and development, and also necessary for the formation of the teeth. And then in it, there will be those minerals, nutrients which are required, like calcium, phosphate, for the general, because they'll be used in formation of the teeth. And then after that, the teeth are formed, and if they are formed they are in good shape, you have to protect them from decay, for example, and gum disease. And that's where, again, nutrition comes in.
Okay.
If you are taking wrong foods that will affect the teeth in terms of decay, then you'll have decayed teeth and you'll be having pain. So you look at teeth in that form, in the form of formation and the protection. And especially the carcinogenic foods, that means those which have got sugar, sucrose, those are harmful, especially if you are not keeping your oral hygiene well.
Okay.
And that will mean that you give the bacteria in the mouth a field where they can act on those sugar-produced acids, and those acids are the ones which break the surface of the tooth to make cavitation. They also affect the gum to make them inflamed and then disease and so on. So that's why nutrition is very important.
Okay.
Information and protection.
Okay. So let's target that on the sugary things, mainly because of the school-going kids. Most of the kids nowadays, they go to school with snacks. You find they have juice, something sweet to eat. Do you advise a parent out there that the children can have that as long as they are maintaining good oral hygiene? Or you completely say sweets and anything sweet, no, out the window?
You see, the problem with the maintenance of good oral hygiene for children is very difficult. One, depending on the age. Secondly, when they go to school, when will they maintain? They are in school from, some of them leave home at 6 or 7, and they are in school until another 5 or 6 again. During that time, will they be able to brush? And if they were to brush, do they have those facilities at school? They don't have.
No, they don't.
Yeah, in some countries, children have been given facilities where they can go and brush.
In this world, they have, like which countries?
Thailand. You have an area where children go to brush. After lunch, they go there.
Wow.
And they brush. There are mirrors there. And they go brush and they go back to school. I've witnessed that. But here we don't have even water in some schools.
Yes.
So they won't do that. So if you have to give a child a snack, and it's good to give a child a snack, give the child appropriate snack.
Okay.
Those foods that do not contain lots of sugar, is good. Why not give them fruits? Give them they're just good snacks as well.
Okay.
And then eating of the sugary foods can be done together with the other general meal. And then after that, the child or the person goes to brush the teeth. So take your foods in the format, like you take your breakfast, you can take your breakfast, eat what you want, and then you brush, you go and do it. Take your lunch, you eat what you want. If you are able to brush, go and brush, and the dinner as well, like that. In between is where there is a problem, because you will not have access to water or brushing, in which case you want to give the right foods to the child to carry to school, not biscuits, not cakes.
Yes. So what are some of these good foods for children?
Well, in good foods, I've already given you. If you are giving fruits, those are good foods for the child to take. There are others which will have protein. They look at in Africa. I've gone to schools here, even in Kampala. The parents give their children, for snacking, they give them beans.
For snacking.
Githeri. They go with them to school. They give them. It's good food.
Yes.
But the child thinks that they have been given the wrong food. The others are taking this kind of thing.
Yes.
But it's good. But if you go with the banana has sugar, right? But it's a good thing. You give a child avocado to carry. You give a child what other things? There are many.
Sugarcane good.
Sugarcane has got sugar though. But apparently, there is one other thing that is important to consider. People take sugarcane. There's people who are taking sugarcane. But in some areas, you find they don't have a lot of decay. In others, a lot of decay. Depends. There's something called cleansing of your mouth. How often your mouth gets rid of the sugars out through dilution by saliva, dilution by intake of water, and that kind of thing. I wouldn't want to tell a parent, give your child a sugar cane to go and take as a snack. That is, let them eat the sugar cane at the right time, after which they go to rinse the mouth or brush them.
So sugarcane is also not good for the...
Sugarcane contains what? I mean sugar. It's sugar. That's where sugar comes from.
But I thought our teeth only get affected by artificial sugar. So even natural sugar is not good for our teeth.
No, artificial sugar is the one which they recommend you use because it is not, the bacteria do not utilize it.
Really?
But sucrose is from sugarcane. And that is the one which is a major cause of decay.
So most people have been lying to us because we were told, actually myself growing up, I was told that make sure you take sugarcane because it's good for your teeth, it strengthens your teeth.
Well, the one thing is it has fiber. The other thing, it has the sugar, which is the only maybe advantage it comes with is it makes the glands, the salivary glands, produce a lot of saliva.
Okay.
If you see, well, the moment you want to take sugarcane, saliva,
yes, salivary glands,
that helps to dilute it.
The sugar.
The sugar there.
Okay.
But it is the one which has actually sucrose, and sucrose is the one causing, which is a major cause of decay. Sucrose is the one we use for cakes. We use for the other thing.
Yes.
So that's the thing. And that's why I was telling you that you will find some children coming or some people coming from a sugar belt area, and they don't have as much decay as you would expect. But the advantage the user will have is the cleansing effect of the saliva. But if you have little saliva in the mouth, and some people do have because of various conditions, either your glands is not producing enough or you have a chronic problem, then you will get decay.
Wow. Yeah, at least I've learned something new today. Is a good oral health only for the rich? Because most people think, since I can't afford a doctor's appointment, a dentist appointment rather, I don't need to have a good oral hygiene.
No, it's not only for the rich. It used to be maybe those years, but I think things have actually changed. From what I have been reading, now oral health should be able to come closer, because now we have got the counties establishing dental clinics in their areas now. And we have community oral health workers or officers coming or being posted nearer to give education and also help in examining people in the area. Now, the only thing is that treatment is expensive. And therefore, that's why it is regarded as
cosmetic.
No, it's regarded it is for the
rich.
The treatment of it is expensive, but prevention is not expensive.
Prevention is easy.
You can brush your teeth.
Yes.
If you can't afford a toothbrush, haven't I seen people brushing with a chewing stick?
Yes.
That is another way of brushing. In fact, chewing sticks, some of them have got chemicals that protect the teeth.
Okay.
So, depending on which tree you are using, you may have an advantage.
Compared to someone
who's using a toothbrush. And one time, I think in 2016, we went to examine some school children in Masai Mara area. And we were surprised. They did not have much decay and did not have much gum problem. So we wondered, some of them had very poor oral hygiene, but they didn't have decay. And then when we were asking them what they were using for brushing,
They
said we use toothbrush and the Colgate. Unfortunately, when I asked them, I said, if I was coming from here, I think I wouldn't use that. I would use even one of these chewings. He said, yeah, that's what we use. And then when I asked them to raise their hands, who are using it, all of them
were using the sticks.
Yeah. And then we told them to bring those sticks. We went tested, and they were found to be actually effective in dealing with bacteria in the mouth.
Wow.
So they are as good if you do not have a toothbrush.
Okay.
But you only need a toothbrush, you need water.
Okay.
And I think most people can get that. So you brush and then rinse your mouth.
Yes.
Yeah.
That's it.
Yeah.
So it's not for the rich. Also for the people who consider themselves poor, it's also for you. This is something that I've seen over specifically the past 2 to 3 years. There's been a rise of people embracing braces. So what is the impact of braces?
Braces are used to align teeth which are not in good position in the mouth. So
as the person, do I get to say that I want my teeth to be aligned? Or I come to the dentist, then you will advise that you need to do this. You need to be under braces.
Yes, you will go to a dentist. He will assess and see if there is need to align them.
Okay.
The fact that you have got a tooth which is just slightly out of line doesn't mean it requires alignment. You can never, in this world, you can never have everything perfect.
True.
But there are other people who may have very serious issues. The teeth are so crowded, they don't have enough space, and they need to be aligned so that one, help them to look better and also help them to maintain good oral hygiene.
Okay.
And helps them, of course, in speaking and what have you. So the dentist will be the right person to advise if you need alignment or no alignment.
Okay.
Yeah.
So you said about spaces in the teeth, so that is some of the occasions where you need braces. If there are too much gaps and they are not aligned.
Not necessarily. There are natural gaps also.
Yes.
The diastemas, natural gaps, those are natural. And there are some people who say, I don't like it, I want it that one. But if you are not concerned about it, it's just part of you.
Yes.
There are others where teeth have been removed, creating gaps. There are gaps in them because of either removed or the teeth are spaced for one thing or another. Or there are other teeth which are embedded in the bone, preventing the other teeth from coming together.
Okay.
Or moving to adjacent to each other.
Yes.
And then there are other occasions where you have bigger teeth in smaller jaw. So everything hinges on inheritance. I may have inherited a smaller jaw from my mother and a bigger teeth from my father. Or I inherited bigger jaw from my father, smaller teeth from my mother. Yes. So this one I will have spaces, the other one I will have crowding. Okay. So in that case, then alignment becomes different. There is one who wants the teeth to come closer. There is another one who wants the teeth to come to be spaced. So and then when you have considered spacing, then you want to consider, are we going to space by removing some teeth in the mouth so that they become fewer and then get space for the rest, or what else? So so it depends from one case to another. Okay.
And what are some of the red flags of quack dentists who say that you can come to my facility, then I'll put braces on you? What are some of the red flags to consider them? Because I've seen mainly on TikTok, but actually, do you know TikTok?
Yeah, I know.
Okay, I'm shocked.
Although I'm not a member of that.
You're not on TikTok?
No.
You need to join TikTok. You record some of the videos here. So there are some guests. There are some dentists rather who are saying that for only 1,000 bob, come get braces. Your teeth are going to be in order. Is that in order?
Let me tell you for a fact. You can't get braces for 1,000.
You can't.
No. The other thing is, for this kind of treatment, there are people who are also specialized in it. It's a specialty of dentists.
Okay.
And their names, you can get them even on the internet.
Orthodontic, right?
Orthodontic.
Yes.
Now, a guy who tells you, I'm going to straighten your teeth for 1,000, how much is he actually charging you for consultation?
Because consultation is a must.
Because you'll have a consultation.
Yes.
You may have some investigations to do before you align them. It is not just looking at the teeth and saying, I want to align. You will do some investigation so that you know they need this kind of alignment and this is what I can do for them to come in line. So that one is, first of all, is not a person you have to go to.
Okay.
Look for the right person, somebody who is trained, because this is going to be permanent. And if they are going to remove something or a tooth, it will be a permanent removal, and you will not have that tooth back.
Yes.
So it may cost you much more later than you would have paid now. And there are also when you talk of braces, there are those we call removable, and there are those we call fixed.
Okay.
In the earlier stages where it is small movements to be done, you may use a removable one in children. And then where you can't use the removable one or the situation is much bigger, then you use fixed.
Okay.
And that requires training.
Okay.
So you don't just go to any person and say that I will do this. It's like repairing your car, and somebody says, so and so is charging you this. DT Dobby is charging you this. Me, I can charge you 500. And then when you go there, messes up with it, and you go back to DT Dobby, and DT Dobby tells you we have to buy the entire this thing. When they could have repaired.
Well, in regards to braces, I believe the audience back at home, they have truly known that. So if someone is charging me 1,000 bob, then hapo kidogo naoshwa. And something that I love about about this facility is that after consultation, an X-ray is a must. That check, we know if there is something else apart from what we are seeing on the surface. That is something really good I love about this facility. In regards to people who are in sports, what are some of their dental safety? Some of the things that they're supposed to embrace?
Yeah, if you are in sports, depending on the type of sport you play, but I can imagine those who are exposing themselves to danger are usually the boxers, and then those where you have got this close contact,
contact sports,
and what have you. Yeah, the danger here is you can either collide with your opponent and you hurt your teeth, and then end up with broken teeth or loose teeth, and so on. So what we as dentists do, we recommend for such close contact games that you have a mouth guard. And the mouth guard is then fabricated for each individual. There is no standard mouth guard where you just go and buy and it fits you.
Yes.
So it's usually made for you to fit your mouth, and then it envelopes the teeth together so that in case you collide, the force is distributed among the teeth so that it lessens the harm. And then you don't end up with fractures and also end up with the looseness of teeth.
And what are some of your final tips on oral health?
My final tips on oral health is that it is a very important aspect of our health. The mouth is where you actually eat your food. The mouth is where you use actually for talking, for smiling, and for tasting. So without the mouth, you really can't do much of, your body can't do much.
Yes.
So So it is an important part of your health, and embrace it. Have it checked appropriately and attend to it appropriately as you will be advised. And keep your teeth brushed every day. And I would recommend for those who are very busy, make sure at least you brush your teeth after your breakfast. And also before you go to sleep. Those are the minimum you can do, because most of us may not be able to brush during the day because of what we are doing. But where you are not able to do, after eating, rinse your mouth with plenty of water to remove food particles, so you lessen the harm that could cause to the teeth. And for children, I would advise the parents to take their children for checkups right from an earlier position. The minimum you have to do is for a child at the age of 1 year, that child should visit a dentist.
What, 1 year?
If you are able to do it earlier, the better. Visit a dentist. For younger children, where you are not sure whether to brush or whatever, use a wet cotton after feeding the child with milk, whether it is breast milk or other thing or other food. We just wipe the mouth. You keep the mouth clean.
So the wet cotton should only have water? Only water?
Yeah, only water. If a tooth has a mite there, yes, use it also to wipe from the tooth. Then you will have a clean mouth. For adults, brush your teeth. Use the commercial toothbrush if you are able to afford, and also make sure you replace it. It is not permanent. You can use it for up to 3 months, and then you replace it with a new one, because the newer it is, the better it will perform. If you are unable, for one reason or another, financially, use a chewing stick. Because it will help you, rather than not brush at all, it will help you also to maintain good oral hygiene. And then the other thing is visit a dentist for checkup. At least once in 6 months will be best. If you have issues, of course, go before it become worse. If you feel something is not right, go make appointment or do whatever. Go to the hospital, visit, and have it checked before it becomes, because treatment of teeth is expensive, and you can avoid that by having those checkups,
regular checkups,
from time to time. That will be my final thing. The other thing is that if you see the teeth are beginning to look different from what they used to be, I can go for checkup. Maybe something is going wrong, and then it can be corrected before it becomes worse.
The final question that I have for you: people say that an electric toothbrush is better than the manual toothbrush. Is that true?
I don't know why they say it is better than it is convenient.
So it's only convenient, it's not better.
There are some people who will have to use it. Because if you are having a certain disability, then you will not be able to brush properly. And therefore, such a people, we usually recommend an electric brush will be better for them, because then it is able to go round. And if they are able to hold themselves, they will take it round. It will do a better job than doing it. But even the manual, if you can afford, yes, use it. I'm not saying you shouldn't use it. But the one thing you know is the toothbrush is just as good as how you use it.
The user.
Even the manual one will do a good job if you use it correctly. The electric one can do a bad job if you don't use it correctly. So it's good. It's just an implement, a convenience for that matter, but it's not that it is better than the manual one.
Thank you so much, Daktari, for joining me in this podcast, and I'm looking forward to having you more on this podcast, because I know questions are going to come.
No problem. You're welcome.
Thank you so much.
Thank you for inviting me on your
Thank you so much, Daktari.
Thank you.
And I know you have become eligible when it comes to oral health, and Talking about that, be sure to follow me on each and every social media platform, that is at Become Eligible Podcast, and my personal social media handle, which is at Kimani Source. If you have any questions or feedback in regards to this episode or the other, be sure to WhatsApp me on my WhatsApp number, which is 0700573437. Thank you so much, and until next time, become eligible each and every day. Bye.
From the mic to the street, yeah, we bring the heat. It's your time to speak, or yeah, take a seat. Become eligible, become eligible. Hey.